Hello. So let's get started.
Great.
Welcome.
We are now live and streaming. Welcome to COVID-19 MON, the monitoring hackathon for the coronavirus crisis.
Hello.
So I'm really happy that everyone's here, and we're going to kick this off. So if anybody of you still needs the link to the YouTube, if you want to share that on your channels, that's just on the hashtag COVID-19 MON, and we're just going to get right started. So I think what we're going to do is start with some introductions. So here is, if you click on the latest, there is a couple of people posting the link now. So just to get the word out, let's spread the word. So my name is Oleg Lavrovsky. I am connecting from Könitz near Bern, and where I have been staying the fuck home for the past week. And on the call with me, I also have the pleasure of having my co-organizers, Matthias Matzenauer, Andreas Amsler, and we have people joining the video call who will be talking about the projects that we have been working on. And I'll do a quick presentation, but let's just quickly do a round of introductions. Matthias, shall we start with you?
I can start. I'm Matthias Matzenauer. I'm co-organized with Oleg Lavrovsky from the Statistical Office of the Canton of Zurich, and we initiated this hackathon to get the community to work with us on monitoring the effects of COVID-19. Yes.
Fantastic. Thank you. Andreas, do you want to say a few words?
Yes. Hi there. Unfortunately, there is no image of me. I'm together with Thomas Lorusso, part of the specialist unit for open government data of the Canton of Zurich, and I have been concentrating on the case data of the cantons. Nice to be with you.
Awesome. Thanks, Andreas. And then we've got a couple of people who are in here. The person who's just joined, could you please click on the top right and set your name so we can see who you are? And let's just get started with from the top with Rock. Rock, do you want to just say a few words to introduce yourself?
Sure. Can you hear me okay?
Yeah.
Yeah.
Okay, perfect. My name is Roko Roškar. I work at the Swiss Data Science Center at the ETH in Zurich. And I joined the hackathon to see if we could provide a service to this community to host and share the data and provide computational environments to eventually process this data. So, and I will show a bit of this work in the session.
Great, thank you. Let's continue down the road. We've got Thomas.
Yeah, I'm Thomas. I'm part of, as Andreas has already mentioned, of the specialist unit for open government data of the Canton of Zurich. And I've actively participated in the case numbers challenge. And that was my main contribution in this hackathon.
And Simone, let's continue with you. Bafe?
Yeah, hello, I'm Bafe, Simone Baffelli. I'm sitting between jobs. I will start a postdoc at the EMPA on air quality soon, and I worked at the moment on the challenge of collecting and assessing the effect or the impact of the control measures. I'll tell you a bit more about it later. Thanks.
Awesome. And we have Noel on the call.
Hey.
Noel, do you want to just say a quick intro?
Yeah. Hey, you see me? I don't know.
Yeah, we see you. Yeah.
Yeah. I'm Noel. I'm working for the city of Zurich at the environmental health department. We are working in the field of air quality measurements. Yes, and I looked a little bit in the project for on the effects of on the air quality.
Great,
Yeah.
thank you so much. So we've prepared a quick introduction just to give the people who are listening in, but maybe don't know exactly how we got here. A quick overview of the last 7 days, basically. So the idea for this hackathon came from the Canton of Zurich, their statistical office, and we set off about 7 days ago. Obviously, there was no physical location for this hackathon. We quickly organized various materials to be able to meet the challenge of monitoring COVID-19 effects using the power of the internet and remote collaboration. The information that we're presenting is available at Statistik.ch, and on School of Data.ch you will find also all the links. The School of Data is a working group of the Swiss Association Open Data.ch, and we've been partnering with the Canton and all cantons all over Switzerland and other institutions for several years, organizing events like this. So the idea of an open data hackathon is basically to collect resources, people, energy, and effort to create open resources, open data sets, open source software, example visualizations, and so on. And we follow the open definition as set out by Open Knowledge International, that knowledge is open when anyone can access it, use it, change it, and share it, only restricted by the need to attribute your sources. So check that out at opendefinition.org. So basically, 24 days ago, at the beginning of March, we've been hearing a lot about coronavirus. It was all over the news. There were, one country after another was basically implementing measures of lockdown. We were all a bit in shock about what happened in China when 15 million people were suddenly placed under kind of house arrest, in quarantine. But on the 1st of March, there was still really no open data set available that represented the situation in Switzerland, even though we knew that there were the first cases coming in Tessin, and we really, people were starting to get really concerned. The government was preparing to act on this, and the Federal Ministry of Health started creating a website where you can inform yourself about the virus, about stay at home, sneeze in your armpit, these kind of things were very important. There was also a symptoms checker that went up. But again, there was the issue that we were not getting consistent machine readable open data access to Swiss data. While we were seeing this happen from worldwide, there were efforts to collect information, to create data sets and use them to inform people very directly about the situation in the country. There were these internet movements. So Stay the Fuck Home is an internet movement, a meme that became very, very widespread, trying to get people to really, stay true to the quarantine. So this also kind of made it clear that people needed to not just be informed, but also convinced to take the appropriate measures and follow the recommendations of their public health officials and experts. The situation on the 5th of March changed. Let me just open this in a different tab. When the Canton of Zurich posted their open data set about their own statistics. So that was Matthias and your colleagues' initiative to really be the, it wasn't really about being the first. It was just the fact that I think you felt really concerned and you got this data set out there, and that's how this all began. Do you want to say anything about that? The 5th of March. What really triggered your first release?
Andreas, you want to say something about that?
Yeah, that's all as it is. As you said, Oleg, we just saw the need to provide this data history-sized, and we then felt that there is also the same need like that we felt from other cantons, and yeah, so we're just doing our job and filling the gap.
Yes, thank you. I mean, it is a super important job that the community felt the need to support. And so this is the situation today, which we'll quickly dive into. Without further ado, we've spent the last 7 days upon the initiative, building upon this initiative and joining the canton of Zurich were quickly people from the administrations of the cantons of Basel and Thurgau and Bern. And we had really support from eventually from all over the country as the open data community began to contribute to this project. So this is a graph of the contributions, and you can see every day we started to have really a lot of work started pouring in from around the country. And so, first of all, before we get any further, I just really want to, for my part, thank not just these 25 people, but there's quite over 40 people. These are the people that contributed directly to the central case data repository, and we'll tell you about this and the other projects. But really, I just want to already begin by saying that it would not have happened if people did not rally behind this cause, did not feel the need to really take the bull by the horns and contribute data. So this is a screenshot from the GitHub repository, Open Data Zurich, COVID-19 here at the top. It's been starred 137 times. There's been nearly 700 commits to this, and 25 contributors have been working on this project. So let's begin right here. And I'll ask, I think Thomas, you volunteered to talk about this, to get into it and tell us about what these case numbers mean and what's happened in the last few days with this project.
I have to say it's just unbelievable. I mean, we started just asking ourselves why we have such difficulties to find case numbers for Switzerland, for the canton. So we started to look, to find numbers that the BAG, I don't remember the English abbreviation for it, publishes. Mm-hmm. And then in the first step, we just like built a scraper to get their data, or we wanted to push to ask our cantonal authorities who are in charge of this subject to publish their figures. But then it just like took off when Matthias and Andreas set up this challenge to like collect all the figures that the cantons are publishing, because it was the only figures that were around that would allow people to track how this disease is spreading. It just, I mean, it grew so quickly, and more people contributing to it, like tracking all the web pages of the cantonal authorities in charge, mailing those authorities to asking for those figures, building an army of scrapers to automate the process, because it was really a lot of work, like by hand to check if the new figures were out every day. Even by night time, people were opening up pull requests to deliver, like to update the case numbers, and I mean looking for errors in the data. It's just like unbelievable. It was really like a really constructive collaboration from so many people. I'm just amazed by how this went, and how we were able, without even meeting a single time physically, all confined to their homes, to build like a data set like this in such a short time span. I mean, as a person working in official statistics, where it takes like years to set up data collection for certain topics, this is just, it's just mind-blowing. I have no, like, I cannot like say something else.
Thank you, Thomas. Actually, could you just tell us a little bit how this data set actually works? So I can see that here on the GitHub page, it says the data is updated regularly. We're seeking to cover all cantons, and that you can get started exploring the data. Is this the current list of cantons and Liechtenstein? Is this being kept up to date as kind of the status of the project?
Yes.
May I answer?
We have this.
Sorry, Thomas.
We have this overview, which is at the moment built by hand. We also want to switch to an automated overview, and just includes the dates, or like we want to do this in the data, so that when you look at the data or the visualizations based on it, you can see when it has been updated. This table is at the moment still built by hand, but we you can see here the overview of all the cantons with all the files. We've built this table at the very start to show for which cantons data was lacking. Now we're not yet like complete. There are still like 2 or 3 cantons that where we don't have the entire time series. I think Canton Schwyz or Glarus. There is not a lot of data for those cantons, but people just today I saw new issues popping up where contributors said that they've written emails and called to push the people in charge in these cantons to deliver this data, and successfully.
So I noticed that even for the canton of Zurich, not all of the fields have been filled. But can you tell us first, maybe, how did you come up with this data structure? What is it based on? Why only these fields?
Those fields, they're based on an exchange with Fabian, who's an epidemiologist and who has contributed in the hackathon. We asked her for advice, which information would be crucial to have for people who have to take decisions now, and that's what she came. That's what we came up with as a set of variables that would be really important to have. Now the problem is that there are some like difficulties with this, because cantons, the only number that all the cantons like really report in I'd say in a comparable way is the number of confirmed cases. And then there are like a lot of differences in what other figures they publish. Some are really, let's say good, and they publish a lot of figures on all who can be filled in all those columns. But others, they don't deliver much yet. I think we have like 4 or 5 cantons that publish numbers on how many people are in the hospital, how many people are in the intensive care units. But I hope that as this goes further, more and more cantons will deliver those figures too. We're also in contact with other cantons to push and move and having all those figures also for as many cantons as possible. because
what do you tell the cantons to do when you send them just this data structure and an example file?
yes, that's one thing. I think Andreas has reached out to the people who can take decisions at this moment.
Maybe do you hear me?
Yes.
Mm-hmm.
You can say
okay, maybe
Andreas.
also via this channel I renew my call or our call to all cantons, all of these Krisenstäbe, Führungsorganisationen to take up contact with us, reusing and applying the data structure that we have developed with experts, which is in place in many cantons, and try to deliver the data from the source to us. So either they are capable of GitHub, to use GitHub, or to send us on a given and confirmed date and time a file. The data has to be more complete so that experts, epidemiologists, and also our Krisenstäbe themselves, that they can do their job best. It's no good flying around with not enough data, not enough information. And it's crucial that this data can be shared by anyone who actually needs it. And it's important that there is a canonical data set from official sources everyone can rely on. So this is my call to the respective people in charge. Today I've received note from the Principality of Liechtenstein. So there we have a contact, and I've received several others. So it seems like there is a need also at the source to collaborate together to this common goal. Thanks.
Thank you very much, Andreas. Do either of you want to just maybe share what were the main kind of frustrations or learnings from your working on this project?
This is a question to me, Andreas.
I was either to you or to Thomas.
Thomas, yeah. Thomas, go on.
Any technical issues, for example, that the open data community could still try to fix?
Yeah, in the next step, we want to provide a file, a merged file for all, where the data for all cantons is in. So that's a thing we're still trying to provide, because that would be useful, especially for those that are not like, versatile enough to create such a merged file themselves, because many of those that have already worked with this data, they were able to do so themselves. But I think to lower the barrier, we have to provide such a Swiss like file. That's the thing we are trying to do as quick as possible.
Yeah. And let's talk quickly about the impact you're having. I mean, I saw that there's already been some media responses. I think the most, you as you said, the project started with creating a data structure together with experts, with epidemiologists, and now you have clearly here evidence of epidemiologists using the data to feed into their models. So I'm just going to open up this Neher Lab project. Do you want to tell us a little bit about what you think the impact of this data is?
I mean,
maybe I tell something about it. I think for the ETH as well, they connected us through the task force, and we see that, and also with the people organized in the hackathon, there were a lot of epidemiologists and researchers from ETH, from University of Zurich, international collaborations, and they work now with this data, and they tell us they need this data and that it is really important for them to work now with this data and to have like really up-to-date data every day. So we see that our work is really fills the gap, as Andreas said.
And you're going to continue updating this data? I think that's kind of the main thing that everybody wants to know. How will this project continue?
Maybe I will answer. So as we heard, we are receiving now professional support from ETH. This is basically helping us to balance the work needed, which has to be done manually, between more people on a, let's say, confirmed basis. So we will move either tomorrow or Thursday towards a way of updating the data manually, which is on less people's shoulders, but on a like working more closely together, a group of people which are trained. I have today performed two trainings for about 5 people, and they also cross-check each other's work. Then our colleague from the Open Data Zurich, City of Zurich team, Stefan Uderbolt, he and together with Thomas, they oversee the scrapers. We are basically at the moment monitoring like very often the scrapers. They are running hourly, and we will see if the plan to update the data manually 3 times a day, 8 in the morning, 2 p.m. and 8 p.m. do fit the frequencies of the updates delivered to us by the cantons. When there will be more data coming in via file or GitHub, we will then assess the situation and on that basis even more automate so to reach our common goal, which is reliable, up-to-date, machine-readable, standardized data.
Fantastic.
So to all of you that maybe now see, I will be not able anymore to contribute, yeah, it will be like that the hackathon comes to an end and we need to bring in more stability. That does not mean that you haven't performed well. You have been performing really awesome. And I want to thank you a lot for that. And please be aware that you were the ones filling the gap when it was most urgently needed. Thanks a lot.
Thanks very much for that message of gratitude. If people want to contact you, if they have questions, if they'd like to contribute to further efforts, there's this contact button here on the project page, and you'll still be in channel. Or will you replace this with an email link or something in the days ahead? Matthias?
This is a question to me. Or,
yeah, just a quick. Just wondering if you're going to have like an official way of contacting. How do you want to be contacted if people want to help or get help?
We are preparing now a press communique for the whole hackathon, and we'll put it on the site as soon as it is finished, which will be this evening, and we will communicate it through our normal channels like Twitter and our website. And I think this is the best way to get in touch to us, to read first the press communique and then call or mail us on any channel and talk to us if there's a question.
So that's going to be on the official website of the Statistical Amt, yeah?
Yes, that will be here and on the hackathon website as well, if possible.
So I think we've heard a lot about the case the case numbers. Now, I want to maybe talk about the efforts that are going into visualizing them. We've had several projects come out of this initial challenge, which are complementary to the question. And for this, I asked Rock to give us a little bit of an overview about what is it like to dive into these numbers, to analyze them and visualize them. Could you tell us a few words about that, please?
Sure. So, yeah, first of all, the data has been very nice to work with because it was nicely structured from the beginning. So it was quite easy actually to dive in. Of course, when it comes to looking at the aggregated data and so on, some additional data products would be nice to have, like was already mentioned, to kind of lower the bar for those who are not maybe so technically savvy. But otherwise, I think the data quality is quite nice. One thing that we tried to do was also to combine it with population data, which surprisingly was harder to find than the COVID case data. So that's not such a nice situation. Maybe I was just looking at the wrong sources, but I'm not sure. So I think maybe Oleg, if you want to. So I wasn't actually involved in any of these kind of fancy dashboards that were created. Maybe you want to just show a few of these.
Sure. I mean, we can start maybe with some of the more famous examples. Let me just switch my tab. So here you have the Swiss COVID-19. Oh, sorry, my sharing went away, huh? Can you see this still?
Mm-hmm.
So this project has been getting a lot of traffic over the past days, as it's referenced in a lot of newspapers. This project is by Skeptice Daniel Probst, who I believe did this as a more or less independent effort. He was one of the first ones to quickly get a map out of there. He's added since the ability to go back in time and see how the situation changed day by day in Switzerland with this graph. You can also see some additional historical data, including prevalence per population, fatalities, and so on. So he's been working quite a lot on this project. We've been in touch, and he's definitely I think benefit also from the exchange from the community here. So this was again one of the first projects to get a dashboard out. Since then, a couple of other people have come in and added their own. So we have this from Christian Schonenberger. Christian, are you on the call by any chance? I'm not sure if he was able to join us. So this is a dashboard created using R Studio. R is a programming language, and it uses the data that we've been showing you before, where you have the list of cantons here, the indicators on the right, map of Switzerland, with the ability to just hover over any one of the cantons and see a quick summary, and also the ability to go back in time and see how the numbers progress. So what the author of this visualization really tried to do, and the motivation is explained here, was not just to create a dashboard which just shows the data raw, but also to try to combat the general feeling of panic, even hysteria, that comes out when you're, obsessively checking the news every minute, trying to figure out what's the situation in your country or in your canton. He wanted to create something that looks more like a professional tool, that is such as the ones that scientists or people in the medical profession would use to present the data very clearly, so that it can be reviewed by someone trying to check whether their model is making sense. Also, what was very important is that all this work is completely open source and accessible to anyone who would like to continue working on that. So if you go to the GitHub account, you will get complete sources for his COVID-19 dashboard, which is of course something we very much support. and indoors. Rock, you when you came into the project, you were aware of these dashboarding efforts, and you also came in to show us an interesting platform. So I wanted to say, I know that Daniel Probst did do something that was not also the case data, but also the tweets. And similarly, you had encouraged us to look at global data sources or to aggregate data from diverse questions. Can you tell us a little bit about how should someone start really analyzing this data? What are some good tools to just jump in and make an analysis?
Sure. So yeah, one thing that we were interested in doing is to not only provide a dashboard with kind of pre-canned visualizations, but try to see if we can provide also the tools for people to go in and analyze this data themselves. So I'm actually part of a team at ETH that's building a platform for collaborative data analysis called Renku. And actually, I didn't know about the hackathon when we started this project, but we started a COVID-19 data aggregation and analysis project on this platform. I don't know how long ago now, a bit over a week ago, I guess. And then we also added this data from the case data from Switzerland, and this project is now updated daily. Yeah, so maybe can I share my screen actually? Is that
sure? Yeah, go for it.
How do I do that?
Bottom left, there's a little monitor icon.
Got it. So. Okay. Can you see it now? I guess you see yourself. Right. So here's
Hold on. I'm not seeing it yet. Is anyone else seeing Rock's screen?
Yes, I see it.
Yeah. Okay, I'll just have to trust that it's working for you.
So maybe I'll zoom in a bit. Yeah. So this is this is part of the Renku platform, and it's a project that we're trying to aggregate different sources from around the world. So we started with the Johns Hopkins. We have the COVID tracking from the US. We have the Open Data Zurich data set. We have data from Italy. And we have a tweet data set also in here. And we're constantly discussing on other data sources to add. And the point is really to provide simple ways for people to kind of dive into this data. So we have prepared example notebooks. So for example, you can see the Open Data Zurich notebook that you can actually, from the platform, you can run. So this is actually now running live in a serve on the platform. I can dive right in and look at this example notebook, execute all the code so that I can get to the data. And what's also possible that we've done recently is to create sort of a dashboard view of this data. So this is a notebook just rendered as a dashboard. And again, anybody can do this. Anybody can come in, fork this project, adapt the analysis to their needs. So our purpose here is not to provide kind of all-encompassing visualizations, but to provide simple starting points for people and to standardize some of this data. So we're going to standardize the Swiss data with the other data sets from around the world so that you can easily reuse the same code to visualize the progress of this epidemic across the different data sets. And this allows you to have simple interactions in here as well, which is nice to just see kind of very quickly get a feel for the different data. And yeah, so this is kind of the visualization part of this project. And I encourage anybody who is interested in actually getting their hands dirty with this data, but maybe doesn't want to go through the trouble of downloading the data, of dealing with the software and so on. You can come onto the platform, you can fork the project and take off from there, and hopefully also contribute back. Everything is open source. And we really, I think, the really important part for us is to get a sense of what visualizations actually and what analysis actually makes sense, because I think we've seen a lot of these kind of cumulative counts, plots and so on, but are maybe not the most meaningful. So the idea is to kind of crowdsource this effort and see what people come up with and do through this effort.
Fantastic, Rock. So thank you so much for sharing that. And I mean, I think it's so important to have open source, accessible bootstraps. But what about this environment? I mean, is this RencoLab environment just for scientists, or can it also be used by the general data community?
It's for anybody. So rencolab.io is open to the world. Anybody can make projects there. Anybody can get a computational environment spun up there. This particular one, the computational environment that we've prepared for this project is tailored so that all the code that's in these notebooks runs out of the box. But you can basically put in there anything that you can fit into a Docker container can run on the platform. And there's a full kind of CI system in the back, so that's what we're using for pulling the data automatically from various sources. So this data for this particular project is actually refreshed at the moment once a day, but we will probably increase the frequency. So yeah, and if anybody has any questions about that, please feel free to reach out.
Great.
Thank you, Rock. Fantastic. Thanks so much for the demo and being available to us. As Matthias mentioned before, there is an ETH task force that is now taking this to a level up. So good luck to you, and hopefully this leads to we're all looking for relief here, and it's really great to know that the best people in the open science area are plugged in and making this happen. I also wanted to ask you, Rock, just one other thing is, we had the question of, yes, I mean, the data is there and everyone's encouraged to just dive in and make something out of it. But do you have any kind of pitfalls or anything people should be aware of as they do this? Any advice?
Well, so we've been in touch with, I don't know if you mean from like making sense of the data perspective or just the visualization perspective, but I'm
just saying, I mean, as a member of the scientific community, I mean, what would you tell us, the wider concerned public, I mean, about what we should and should not be do as we try to follow in your footsteps?
Well, I think so. The biggest frustration for me personally with the Swiss data has been the lack of information about the volume of tests, because the number of cases actually doesn't mean much unless you have also statistics about the testing that's being done. Mm-hmm. So this is, I think, a huge problem, because you basically have no handle on the bias in any of these trends. So it's very dangerous, I think, to plot basically time series data and look at doubling times, et cetera, when there's actually no underlying information about the volume of the tests being performed. So that as somebody who, as a scientist, it's very troubling to me to not have that information. So hopefully that I know that many people have been trying to fill this gap also in the effort in the past week, and I guess it's been very difficult in Switzerland, apparently more so than in other places. And I hope that the situation will get corrected. But I think, I mean, from what I can tell, again, I'm definitely not an epidemiologist. I'm an astrophysicist, so definitely from a different branch of science. But I think, from what I know, this is a very serious gap that we currently have.
Yeah. So a couple of weeks ago, I mean, we started, first talking about plotting epidemic curves, and there was a number of threads about the fact that these data was so hot off the ground, so inconsistently collected, so many assumptions to take in, and just for people who are not familiar, with the way the health system works, with the way public health assessment is done, it was it's very likely, in fact, that you would start plotting graphs and doing analysis that are that maybe do potentially more harm than good. So I think this is just an important message that I think we as members of the responsible data community should really say to anyone who digs in. Be aware of how reliable your data is. Be aware that humans are perceiving this, that they might misread what you're doing, that there's a lot of people have been trying to compare various epidemics, the Spanish flu and so on, and try to make extrapolation from that. According to public health people, there's really like no two epidemics run the same way, so be careful with that. And I think this is kind of, for me, the key point. Be ready to defend your work. And as you said, you're an astrophysicist, you're not an epidemiologist, but you're still, you're willing to step up to the challenge. And someone who comes in and who challenges and questions you, you can, the fact that you're able to have an intelligent debate about the topic, armed with data, armed with numbers, makes it, much more likely to transform hysteria, hype, and fear into something constructive, something we can all learn from. And I think this... yeah, sure.
May I add something? It's really crucial. That's my message to all of the users of our data. Is be transparent. That means make your code open. Say where are the sources of your data. Make your models open, because then it's easy to defend. If you don't do that, then it's hard to defend. And we will follow the path to make our models and our visualizations open source, because that's the way we think for years, proven record that this works. Thanks.
And it's just, may I add, it's just about the debate. We need to have a debate. It's better if more intelligent people work at some code or work at the models than just one person or one group behind bars and not talking to anyone else. So just to have a debate, if it's defending or not, is really key, I think.
Yeah. Yes, and if anyone is going to be taking the bootstraps that Rock has showed us, or digging into the data from global sources in other country, just really important: cite and cite well. Make sure you have a clear statement exactly where your data is coming from, who's responsible for maintaining it. Put in a link there. And really, don't shy away. Don't make this really visible. Don't put this somewhere into the impressum or somewhere hidden. This in fact helps your defense, because at the end of the day, your visualization is only as good as the data, and we want to encourage you to try. But ultimately, our goal, as I said at the beginning, is to get this up on. For all the cantons on portals like opendata.swiss, which put a clear terms of use, an organizational owner, all the metadata that people need to know to really understand the circumstances, the context, the limitations as well of the data they're working with. Fantastic. So we've talked a lot about the Fallzahlen, and I am just going to say this, that if anyone has a question, we are monitoring Twitter on the hashtag COVID-19Mon. So please don't shy away from posting a question there if you're watching, or directly into the live stream. I see that there is actually a comment coming in that from Adrian Gschwend saying you can get population data per municipality via Sparkle. I can provide you some queries. So this is someone from the linked open data community, volunteering some advice. Adrian, to you, I can say, please join us. Come into the project page here, and please feel free to add your suggestion, add your data query directly in there. Muriel Linnea, also over YouTube, mentions fantastic final presentations. Congratulations to all enthusiasts and contributors involved. So thank you very much, Muriel, for echoing our thoughts exactly. And finally, we have at the moment a comment from Robert saying, document, 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 with a winky face. So again, a reminder that everything we're doing should be out on the internet, should be documented, and leave a path of breadcrumbs there for other people to follow and build on what we've been doing. So thank you very much for your comments. Keep them coming over the various channels we're on. So at this point, I'd like to just quickly continue in the few minutes we have remaining and go through 3 other projects that have been happening right now around additional data. And I would like to start with evaluation of control measures. We have Bafe, who's been very patiently waiting for his chance to talk about this. So Bafe, you're up and tell us, what is the project about?
Thanks a lot for the introduction. I must say this is not a very sexy part of the project, but I believe it's a very important part nevertheless. The idea is that we are collecting, the other teams were collecting, let's say, the dependent variable or the observable or the target variable. We are collecting the independent variable, which means the control measures that were taken to stop the spreading of the virus by the cantons, by the regions, by municipalities, by event organizers. We've been collecting systematically these measures in a data set. We were coding them, sorting them by date, by region, by unit. We created a very long data set with the help of Fabienne, epidemiologist. So basically, I just went through all the ordinances, all the regulations, and created an entry for each recommendation, for each change of law, for each measure that was taken to control the spread of the virus. Because we believe later on we can check and try to understand the effectiveness of those measures by comparing them with the epidemiological curve. I'm not an epidemiologist. I'm not going to discuss how to do so. I just wanted to provide this service because I believe science, in many cases, profits a lot from these data sets. It is not sexy, as I said, it's not appealing. It's a lot of boring work, and I'm very grateful to all the people who contributed to this data set. On top of that, another idea which we didn't develop further to check the effectiveness of the measures is also to look at indirect indicator like movement of population, traffic data, air quality data, and I think somebody is going to talk about it later. But I really decided to concentrate on this huge, boring effort, only coding all the measures in a clearly understandable way. We also now automated the process a bit. We also set up a Google Drive where everybody can edit the data set and add information. You can see examples of the measures and how we coded them. It's a long data set in a tidy format with date of implementation of the measure, description, categorization of the measures, the source, everything is systematically collected. So everybody is free to use it for modeling later. It's already open and available, and we are accepting contributions. So we set up some partly automated process. You can edit a Google Sheets doc. I start my script and I obtain just CSVs in the correct format. Nothing fancy, but it works. And we are very happy at the state of the project. It is not very exciting, of course, for most people, but I see it as a gift for future epidemiologists mostly.
So we have been hearing discussion from the wider network about the way the other countries besides Switzerland are responding to the crisis. I mean, there's the we get broken bits of news reports and so on. It's very difficult to have a complete picture, for anybody to see where countries are in this kind of timeline. I think everybody was aware what China has done and to some extent what Italy has done, but now this is spread throughout the entire world. Evaluating control measures and where they're being placed and where they're not being placed. I mean, I just yesterday heard from some people in Brazil that their government is very much in denial at the moment. Not taking the measures that are being recommended. They're just like their northern North American neighbors were doing about a month ago. So, can you tell us a little bit about the data that's not in there? I mean, do you think that from a public health perspective, there could be potential for some studying when certain measures were not taken as well, and maybe contrasting those with what other countries are doing?
Well, I think this is too early. I think you would need a systematic collection for other countries. I believe this is not a problem at all. It's the typical and very good example of a project that can be crowdsourced, because everybody can contribute, because most people can just contribute to a Google Sheets doc. And then I believe later on one can for sure do some modeling. I'm not going to say how, because I'm not an epidemiologist. I'm a remote sensing specialist, totally different field.
Mm-hmm.
But I think you can show some information, so you can compare it with other countries, as you said. You can compare the measures with the number of cases. You need always to consider you're always going to have the delay for two reasons. First, people need to change their behaviors. Second, the virus, of course, has a certain incubation time. So you probably need to take the delay into consideration in some manner. And I think the same you can do also with indirect measurements, like how much are people going out, how much are people moving. You can use mobile data and correlate it with those measures to see if people, after a certain measure, move less, visit certain places less. We had no time to start this sort of analysis. I wish we could. I hope we can still keep on working. And I'm very happy so far at the status of this data set, and I hope it's beneficial for others.
Then can I just thank you, Simone Baffelli, for the great work you did, because already now I think it's a really valuable source to see, also for media people, other people putting out stories, just to have like this gathered overview and standardized overview of the measures. And it's really great, and you did a lot of contributions to the hackathon, and I'd like to thank you personally for your effort right now.
Thanks. And maybe I wanted to add something regarding the data set. Well, we are open for contribution, first of all. And no, go on. I think I will remember later.
Okay, no worries. So, so I think it's clear that there's a collection effort that has started. So far, there's no visualization or dashboard.
I was considering to start one. I did one for myself with ggplot, but it's not very exciting. Of course, it's just a series of dots. Mm-hmm. Probably one should do some interactive visualizations, mm-hmm. like using, I don't know, some better library. I haven't started that yet. I consider doing so. But I think it's only really interesting, especially for a wider public, if you show it alongside the number of cases.
Right.
Because otherwise, I believe it's a bit dry.
Okay, great. No, thank you so much for sharing this, and I think it's very motivating. I mean, I think for anyone who's listening to this, who is from the public health area, this is the kind of stuff that you're going to be finding very useful when you're, hopefully when this is all over and we're telling the stories and writing up science reports.
Actually, even live probably, because you could, let's say, in near real time evaluate last week's measures and find out whether they worked or not. So you could adjust, navigate somehow through your measures and adjust them accordingly, probably. This is somehow the long-term vision. It's not very realistic, but I felt it meant to be mentioned.
I have to say that on this just note that I did post a couple of days ago, just forwarded a discussion from the Swiss Personal Data Forum. Paul-Olivier Delahaye, who's a well-known activist for data protection, has been mentioning the fact that yes, we absolutely want to stop this epidemic, and we're implementing a lot of things right now. I mean, people who are out there on the front lines are using these kind of models, are collecting this kind of data, trying to make rapid-fire decisions. But we have to be aware that some of the decisions that are being made in government and elsewhere are things that we may end up regretting in years to come, because we are trespassing in certain borders and he asked kind of the question. So, are we? Will you use the app? There are several apps now which are asking you to report on your coronavirus test results, even on your movements and your social network. So I think that there's both a huge opportunity here and also a huge responsibility that we need to take within the open data community to point out the risks that are being taken and to make the public a bit more aware that they should check to see that the data that is being collected is being collected safely, responsibly, that they have the ability to pull themselves out of the study if they don't agree with it, and that their personal identities and digital movements are not going to be compromised by some of these things. So that's it. Let's see. I'm just going to check to see if there's any questions about this project specifically. I don't see them right now, so let's just. Is everyone okay to stay for a few minutes past the hour?
Yes.
If you need to drop off, or just let us know. So we have still Noel and Thomas on the call. Which one of you wants to go first? Sorry, Thomas. We've had Thomas. We've had Noel.
Yeah.
You're next.
Okay.
And what would you like to talk about?
Well, you asked me to talk about the project or the air quality. I was not responsible for the project, but we contributed some data, and we had a lot of discussions with colleagues. What the problems are? It's normally a problem to measure short-term effects on the air quality, because air quality is influenced also strongly through the meteorology and weather effects and
so let me
things
just
like that, and traffic. We look.
Can I just interrupt you for just 1 second? For the people who are on this call who don't understand German, unfortunately, everything I'm looking at here is in German. Could you just tell us just very very clearly? This project is to look at air quality in what sense?
Like the effects of the how do you say, like the effects on the
it's the effects of the epidemic on the environment,
yeah,
right?
of
Not the other way around.
Epidemic or the
measures.
Sorry?
Effect of the measures, not of the epidemics itself. Sorry.
Yeah, the effects of the things you do, of the things of the shutdown, for example, on the air quality. I think I could imagine the idea at the beginning was that in Italy I have seen some satellite pictures of where the NO2 data was heavily reduced during the shutdown. And yes, like you see here, traffic counting at the Rosengartenstraße. That's one of the biggest roads in through Zurich. You see a little effect, but these data goes only through until Friday. If you would go further, you would see a more dramatic effect on the. I don't have any graphics now to share, but I've looked a little bit. We haven't done much analytics till now, but I've looked a little bit into the data, and you can see since Friday night you can see a reduced traffic on the roads of Zurich. We've only looked at the traffic at the city of Zurich, and this graph, a colleague of mine has rapidly made it.
Yes, that's Thomas von Allmen.
Yes,
he works for the city of Zurich, right?
Yeah, it's a colleague of mine. Yeah, he's a little bit better coder. He made these graphs from several measurement stations for in Zurich, you can see Zurich Bürl is like at the border of Zurich with a low impact on emissions, and Schimmelstrasse and Rosengartenstrasse, for example, are higher polluted areas. You could think, if you look at the graph here, that the black line are the actual values. You could think that you see a big effect, but the problem is that since Friday we have a strong northeast wind situation, which brought a lot of cold weather temperatures also, and we are not sure yet what the impact of this weather situation is on the air quality values at the moment. We will see. I think you normally need some weeks to see of data to find some effects.
Mm-hmm. So all the data that you've been using, or your colleague has been using, is open data. It's available here from the city of Zurich.
Yes, we made some years ago some data from Zurich, city of Zurich available, but these are only like the main values. It's also ozone, NO2, and PM10.
Mm-hmm.
Yes, right. These are hourly values, and we have some historical values as well.
Mm-hmm.
These are updated. The hourly values are updated every hour. I made another export for this project with some more stations in the eastern Switzerland region for 8 stations. Only for NOx because like the NOx is more influenced from the traffic. So our guess was that you see the effects more on NOx because NO2 and ozone are influencing each other also.
Thomas mentioned that it's not that he used open source tools. This Open Air project for analyzing the data. Is
right. Yes, we are using this tool. He and a colleague from the canton of Zurich, they also started to make a package of its own called Rostluft, because the cantons of eastern Switzerland, they have how do you say, they work together.
Mm-hmm.
So this project is called Ostluft, but these data are not yet, they're hardly available for everybody at the moment. We are working on making them more open.
Okay.
There is this R package is really great. It's on GitHub.
You mean Open Air?
Rostluft, yeah, this Rostluft, and there's also a tutorial on it. Really great to work with.
Yes.
So
let's
let's
a lot of data for the last 20 years, and yeah, right.
So it would be really great if you could add this to your project page here, and
Yes.
I'm sure people would want to follow up with this. I mean, it's one of the kind of silver linings in this whole nightmare pandemic is that it has had an effect on the climate. We saw that happening in China and in other countries quite quickly, and of course in Switzerland we are really want to follow up on this and see what kind of climate-related effects and just how temporary are they or permanent they are, and what we can learn about this from this unprecedented situation of people being locked up at home and not commuting and not doing a lot of other things they're usually doing.
Right.
Fantastic. So if there are any questions for Noel, I will be happy to take them. Just checking our various feeds. And Noel, are you going to stay on with this project? Will it be possible to continue to contact you and offer you some help or replicate what you're doing?
Yeah, we have to look into it. I have to discuss it. How do we do it? Also with my colleagues from the canton. Yeah, and we have to make sure that we can update the page and the data and probably the contacts where. Yeah, I think we'll do that. But there's a lot to do at the moment.
So that's great. I mean, if you keep this page updated, by the way, feel free to use German. We do have a Google Translate feature built in, so someone who needs to read this in English can just click on the link at the top of the page. En français aussi bien sûr. Nicht parlo italiano, but of course for the Italian part of Switzerland, we also have the Google Translate enabled. So I have. So thank you very much for this. I know Bafe, you also did quite a lot of work here. You did the first draft of the report, and I think this is a super exciting project. I think we should really just talk about one final result of this hackathon. I mean, there have been a number of challenges that were present at the beginning 7 days ago. Not all of them had a team form. Some people have been working really much independently of the hackathon. We definitely want to have this platform here as a kind of a showcase to just see what people are doing in the wider community. Our focus here being really open data, open source, and open collaboration. But there's this project about the hospital infrastructure data. This is something that I've been personally quite concerned about, trying to help out with as much as possible. Is there anybody else on the call who wants to talk about this, or should I just quickly go through it?
No, do it, Oleg. I think it's really nice if you do it. You were quite involved as well.
Okay, so I'll try to do this quickly and succinctly, and it's your job to let me know when my 3 minutes are up. So, basically, as the project with the case studies got started, one of the epidemiologists, Fabian, who was in contact with us, proposed that for effective modeling of the epidemic, it was really important to have detailed information about the hospital situation, because one of the main reasons that we were told to stay the fuck at home was that we should contribute to protecting our elderly neighbors, to protecting each other, but not only because people were going to get sick, but also because of the worry that the health infrastructure will be melting down. I mean, this is the story that we're hearing from all over the world, from our southern neighbors in Italy to stories coming in from the U.S. and other places about the hospital staff, the buildings being completely full of people in the hallways. Spain recently, there was some shocking footage of what it looks like when your hospitals are just completely overrun by people suffering from coronavirus and related illnesses. So the idea here was to collect these indicators of interest that were specific to the health infrastructure. Fabian initially suggested that we just look at the basic situation. Where are the hospitals in Switzerland? How many beds do they have? How many intensive care units they have, because a lot of people who reach a critical state in the coronavirus disease, they need ventilation, they need drips, they have a failure of the respiratory and sometimes cardiac system, so they really need intensive care units, and the number of respirators being especially important for your lungs. And then the Bettenauslastung, the availability of the beds. So it's basically like the baseline before the crisis happens. How many people are usually in the hospital? So on which basis we can estimate how much space there is actually left for incoming patients. And finally, the number of nurses and other indicators, more about really the support staff, as these hospitals faced shortages of people and also materials, are the kind of things you might want to track. So we have a long list of tasks. As you can see in this project, we didn't manage to get nearly as far as we wanted to. There's still a lot of work to be done, but there is some really concrete, from the beginning, we were hearing about how important this is to do this kind of work, and have been trying to do our best to get in touch with people who have these numbers. we created this basic workflow based on the data sources that we researched. And this is the thing, right? I mean, at least with the case numbers, you know that there's like one or two Stellen, offices you can reach out to, and they will have the situation. When it comes to hospitals, there are a lot of different data sources. Kind of on the national level, we came up with a whole. We have the base list from the Federal Office of Health, but it's very much out of date. So this is the from the Open Data Swiss portal. I'll just show you here. This was the basic resource for us. The Kennzahlen der Schweizer Spitäler has not been updated for a couple of years. So obviously there are some, in the last 3 years, there's some new hospitals that have been built, or changes in the facilities. But this is basically the result of a survey that the Public Office of Health in Switzerland does to make sure that they have a complete appraisal of the health system. This was the base data set for our work. We further, that data set has a list of addresses, and we were able to geocode them using the Swiss Names 3D data set. So thank you very much to Swiss Topo for helping us to connect their data for that. And thirdly, we actually extracted the list of intensive care units, which was one of these key indicators that we wanted to find from the Swiss Society of Intensive Medicine. They do certifications of hospitals, have a data set in the form of PDF, not very open data, but it was available to us. We were very thankful to get it. And thank you, Jonas Herzog, who did actually a visualization, which was very cool. It shows a map of Switzerland and its hospital infrastructure here. And here you can see the in pink, or purple, the University Hospital, for example, having 64 beds, and in other colors, the status of that medical facility in terms of its intensive care certification. So working with Jonas and other people, we have this project going, data on hospital infrastructure. We have created an initial data package. So this is something you can. Oops, the link is here. This data package contains the list that we collected, as well as the initial numbers that we have from the Office of Federal Health. On top of that, we have created with Fabian a data dictionary, which helps to explain a lot of this kind of really medical literature terms, abbreviations, and so on. Very important to work with this data is to have a data dictionary that we've created. And there is a more kind of a merged data set which contains the ICU numbers, as well as the geolocations, as well as these basic stats about the number of beds as best as we have available. And we also created a little bit of a crowdsourcing process around this. This is currently not being actively used, but that we do have an online form for Swiss hospital data, where someone who is working in one of these medical facilities can just insert their healthcare provider and give us basically give us the answer. Tell us, for example, how many beds are usually occupied pre-epidemic, or any other data that they want to contribute. They can just do through this form. And for us, it's of course very important that we do a bit of a quality control. So we're really interested if to know about hospitals that are very much like official institutions. We need to make sure that anyone contributing to our project is making a best effort to check the information is correct and up to date, and that people are in close contact with us for any questions, follow up on this data collection effort. So this is just getting started. I do want to just share one last thing. Namely that there is an ATH project that is working on a report. They have tweeted something yesterday, which is very much worth looking at. Let me just pull out this tweet. I think here it is. Yes, and this is our visualization of the ICU beds and the cases, so COVID cases, and on top of it, the beds and ventilators across the hospital. So this is one of the kind of collaborations that we've been supporting. They're going to publish a report very shortly that assesses the situation in Switzerland and also the effects of the control measures, as we were talking about earlier. So that's from Thomas van Böckel at the ETH Zurich. And one other really interesting project that I would like to mention now is from this one. This is from Plotti, a data scientist in Winterthur. He's working also on a visualization of not a visualization. He's working on a model of how many beds are still available. So basically, this is the best known situation in Switzerland. How many intensive care beds are there? How many percent of the infected people need an intensive situation? And he has actually an online situation modeling tool that he's working on that includes this data. And the other modeling effort is the one from Richard Neher and folks collaborating with the University of Basel. That one I showed you before. So all of these efforts to provide decision-making support using open data is listed on the Data on Hospital Infrastructure project, where we're really trying to help flatten the curve and do whatever we can to support people in the public health area, to support the people in healthcare. Yeah, please let us know if you have ideas or thoughts about this. I think that was more than 3 minutes, Matthias. You should have stopped.
Yes, no, it was so interesting. So I didn't stop you at all, Oleg. And it's a really important data set, I think, that we should continue to work on.
Yeah, and actually, maybe you want to say a couple of words about your own efforts in regards of the hospital administrations. The medical administrations.
There's not much to say. We are trying to get this data open, to get like actual up-to-date daily information about the hospital infrastructure open from diverse cantons as well, but it's really difficult and hard. But we are working on it behind the curtains, behind the bars, hard every day to get this data, because we think it's really important. And we have also a big support from the ETH task force that helps us with the Fallzahlen, the COVID-19 case numbers, and also the hospital infrastructure, because the data for them is really valuable to make the models as well, to support decision making, as you said, and so on.
Thank you, Matthias. So we're going to try to wrap up in the next 5 minutes. As I said at the very beginning, we are super impressed by the amount of people and amount of work that has been pouring into this effort. Again, really, from my side, thank you very much, everyone who's come onto our platforms and participated either on GitHub, on DribDat, in the chat channels. You are all absolutely awesome supporters. If your name is not listed on our official Hackday page, we can fix this. We really want to make sure everybody is recognized. In the next few minutes, we're going to be sending out a survey form to everybody who has been participating. We will give you a chance to supply your contact information and make sure you can help with that. It's really been a team effort.
For the contact information, really important that you send us the contact information, not because we want to track you, but we want to invite you to a pizza and a beer when we are all healthy again and can all connect in the real world again with each other. And then we want to invite you all to a pizza and a beer and see each other into the face and, yeah, shake hands again. We are really looking forward to this. So please leave us your contact information. It doesn't matter if it's Twitter or whatever.
Andreas is about to go. He wants just to share one last thing, I think, before he does. Andreas, you want to say something about this?
No, I've talked enough. And, thanks.
Thank you so much, Andreas, for all your support and motivation, for the transformational role that you have in a lot of these efforts. So it's a real pleasure to work with you. So there will be definitely a possibility to get pizza and get beer and to stay in touch. We're going to very shortly also announce some opportunities to continue your work through other events, which are following shortly on the steps on the heels of our effort over the past week, there is going to be a very big hackathon. So we had, just to give you a little bit of idea, we had 49 active users in these kind of 12 open channels. Over 3,000 posts have been written just by the group of people that has been working here over the last 7 days. Countless Git commits and so on have been done. And this all happened because you saw these open challenges, you got interested, and you got involved. Everything that we used for this hackathon is open source and reusable. The DribDat platform, which has helped us to kind of keep focused on the challenge and make sure that we are fixing one thing at a time in the world, is open source, and you're welcome to reuse it. The whole kind of, a lot of the open science project, like the epidemiological models that we've been using, are linked from our data science notebooks, from our documentation, and are there for you to learn more about. The data is going to continue to be available on these portals, as is the data science environment that you were invited to use early. Please use these resources available to you, and please use them responsibly, making sure you cite your data sources, making sure you let users know about what they're seeing, and not counting on people to be objective when they're viewing this kind of thing. The open source movement, the forums from Open Data CH and the chat room that you've been using will remain open for the foreseeable future, and we're going to try to keep that running as a resource for the community. Thank you very much to Jitsi, the open source project that has enabled us to have this video conference that we're live streaming over to YouTube. We've experimented with several. We've had kind of a number of technical issues, but Jitsi has been really a fantastic and completely free resources for us to use to tighten up our virtual collaboration across video channels. So thank you very much to all. It's been an absolute boost for me to be part of this. And again, stay tuned and save the dates, please, from the 2nd of 5th of April. There's going to be something really big happening in Switzerland. If you've been following the news from Germany, from our neighbors up north, and their Vir versus Virus hackathon, expect something similar in the works. And we're going to also link over Twitter and other channels to people doing this kind of collaboration. To all of you who are continuing your work, please keep letting us know about your progress, and we will give you as much of a boost as we can in these difficult but also really exceptional and amazing days to come. Last words, Matthias? Have I forgotten anything?
No last words. You did it really great. It was a great experience. I want to thank Oleg. You thanked all the contributors. I want to thank you, Oleg. Especially, you made it possible to organize a hackathon in 2 hours.
It's all the
We had
pandas.
the idea at Tuesday, 4 o'clock, and at 6 o'clock, the hackathon page was running, and we could announce the hackathon. It's like incredible what you did and how you helped me to manage it. This hackathon, really great.
Well, it was
Thank
a
you
team
very
effort.
much.
Let's do it again soon. Thank you, Matthias. And thank you, everyone who's in the call and everyone who's out there in the live stream. I'll be chatting with you guys later. Take care. Be healthy. Thank you, and see you again soon. So,
Bye.
Great.
Thanks
Bye.
a lot, Oleg.
bye-bye.
Many thanks, Oleg. Bye.
Bye.